Concussions and mental health. This creates a lot of confusion for people because ultimately, many after their concussions will suffer from depression, anxiety, irritability, anger, and other things like that. But there's a big problem because in my experience, many people have been diagnosed with a mental health diagnosis while their concussion is often ignored. This leads people to have a lot of frustration. So why is this important? Well, getting the right diagnosis is key to the right treatment. So if we want to use traditional medicine as an example, if you get diagnosed with depression, for example, you may get prescribed Zoloft, Prozac, or some of the newer medications. But is that really the right treatment if your depression is from a concussion? The answer is no, it's not. So first, we've got to really step back, and we are going to start by dissecting when is it the right diagnosis. So bear with me. And you may be wondering, well, why should you care? What do I have to say matters? Well, my name is Dr. Zimmerman. I've been treating concussions over the past 10, 11 years. And many of these people come in with wrong diagnoses from anywhere from hormone imbalances to thyroid to depression, anxiety, and so much more. And they're trying to overly compensate on that side while their brain's being ignored. So we're going to walk through this. So first, when we look at a mental health diagnosis, ADHD, depression, anxiety, bipolar, any of those, the very first stipulation is no better explanation. Okay? There cannot be a better explanation for those symptoms. So what does that mean? Well, if someone has a low thyroid, they can have issues with fatigue, motivation, right? They may be a little down. They may not seem like they want to do things. So if you give someone the label of depression when they have a low thyroid and you've completely missed the low thyroid, you are treating them wrong. That is bad medicine, period. Bad medicine. So there should be no better explanation. So when you're being given the diagnosis, or when providers are given the diagnosis of depression, anxiety, bipolar and things like that, you've got to make sure you're rolling out the other things that make sense, right? That it could be. Unfortunately, a lot of people in the brain injury world end up in mental health because they do have those symptoms, which, as we're going to go through the research, is very, very common. But it's not the right treatment. So once again, no better explanation when you give a mental health diagnosis. But guess what? The same thing is true for a concussion diagnosis. We are going to walk through what that looks like. So at the end, though, it's going to be no better explanation. Now, first thing that you need to have for a concussion diagnosis is one, injury type. Okay, mechanism of injury. Did this event possibly cause a concussion? So what are some of those things that can cause a concussion? Well, a direct blow to the head, right? Maybe it's a fight, maybe it's hitting your head on an object, maybe you're in a car accident and you get punched in the face by the airbag, or you hit your head on the headrest. All of those things can absolutely give you a concussion. Now, do you have to actually hit your head to sustain a concussion? The answer is no, you don't. So a whiplash mechanism, specifically in car accidents, is a really big driver of a concussion. So one, do you have the proper mechanism, right? So if I take a Kleenex and I throw a Kleenex at you, right? Throw it, hits you in the head, cannot give you a concussion. That would not be a plausible mechanism. But if you're in a car accident, you have a slip and fall, you hit your head on a cabinet, right? Something falls and hits your head. Any of those, yes, that would meet the right mechanism of injury. Next, these are the initial signs, clinical signs following the injury. So what are some of these? Well, let's say let's use a car accident. This would be someone who's dazed and confused, right? They're disoriented. That would be one. Vomiting would be another one. Loss of coordination, right? Like someone stumbling. That would be one. Okay, there's others beyond that. But if you had those two, you would actually check the box for concussion as long as there was no better explanation. Anybody's saying like, well, but I mean, that's pretty obvious. You're right, it is. But we also have people who do drink and are impaired when they're driving. So you want to make sure you're blaming it on the right thing. Next, symptoms. Okay. Symptoms should be appearing within a couple of days of a concussion. Now, that does not mean they cannot progressively get worse, because they can. It doesn't mean the initial symptoms you have cannot evolve and you add more symptoms later. Okay? But what are some of the symptoms you may have? Brain fog, word finding, memory, attention, headaches, neck pain, energy changes, fuzzy, blurry vision, dizziness, nausea, and other things like that, right? So now you don't need all those symptoms, okay? You need two. You need two of those symptoms to be either new or worsened since the injury happened. So I get a lot of people like, but I had pre-existing headaches. Well, okay. How often did you have them? Well, I mean, I had about 2 a month. Okay, and now what is it now? Well, I mean, now I've got a headache every day. Okay, so that's a worsening, right? That would count. Okay, so those are the big ones. Now, next, testing. Okay, testing. Yes, there's tests for concussion, and no, it's not imaging. Imaging currently is meant to rule out something more serious, like a brain bleed, a fracture, and other things like that. Now, when I say serious, I don't want you to think concussions aren't serious, because they absolutely are. Okay, but what testing should we be looking for a concussion? Well, currently the best testing we have, eye movements, using computerized eye movement testing. Balance, eyes open, eyes closed on a firm surface, but also on a perturbed surface, so like a balance pad, and even cognitive testing. Now, the kicker on this is your eye movements, when we do your eye movement testing, could appear completely normal. But if it creates symptoms, that is a check mark. Now, you don't have to have deficiencies in all those areas of testing. Only need to have deficiencies in one area. And lastly, number 5, which we're not going to put on here, is imaging. So if imaging abnormality shows it's not a concussion, you've left that. Now, there are some advanced types of imaging, functional MRI, DTI, diffusion tensor imaging, and stuff like that, that can pick up some concussions. Still not going to pick them all up. But for your regular MRI, CT scans, if those are positive, you've left concussion land. You're at minimum a full-blown mild traumatic brain injury, if not a more severe traumatic brain injury. All right, so we've got criteria. Do you have this? Yes, right? So that would mean we made sure there was no better explanation. We also went through the proper diagnostic workup and history to make sure you got it. So we're saying check, right? We know this person by all means has a concussion. Now, the part we are going to jump into next is, what does the research actually show?
Association of concussion, brain injury symptoms, and diagnosis with mental and social well-being. Okay, so this was back in 2020. What do they find, right? Prior concussion or brain injury symptoms and diagnosis have a higher rate of mental, social disturbances, and more frequent need for mental health services. Let's say that again. They have a higher rate of mental and social disturbances and a more frequent need for mental health services. So what? Depression, anxiety, irritability, counseling, ADHD. And what do they also say next? Nearly 1/4 of children with significant symptoms after head trauma are never checked for a concussion or a brain injury. Okay, so 1/4 is what they report. All right, on to the next study. Women, nearly 50% likelier to develop depression after TBI compared with men. So 29% of women versus almost 22% of men developed depression. Prevalence of concussion, of depression in adolescents with a history of concussion. What did they find? History of concussion was associated with a higher prevalence of diagnosed depression. Clinicians should screen for depression in their adolescent patients with concussion. Once again, though, a lot of these aren't ever being evaluated for concussion. So how do you screen for something that hasn't been looked at appropriately to begin with, right? And then lastly here, history of concussion was associated with a 3.3-fold risk of depression diagnosis. Next, persistent post-concussive symptoms in children after MTBIs, prevalent and vastly underdiagnosed. So what they did was they looked at children who were anywhere from 6 months to 30, or on average, they were 6 months to 60 months out, right? And guess what? The prevalence of these symptoms was not influenced by the time that elapsed from that. So persistent post-concussive symptoms is underdiagnosed in the pediatric population, 25% of children. Once again, it's not diagnosed, but yet they ultimately end up with a lot of mental health diagnoses, which we'll come back to the study in a second. Risk of mental health problems in children and youth following concussion. Concussion was associated with an increased risk of mental health issues, psychiatric hospitalization, and self-harm. All right. So what were some of the symptoms people actually were dealing with? Let's go and look there at these children. Headache, concentration, frustration, irritability, memory problems, depression, taking longer to sleep, sleep disturbance. Okay. So if a child goes in with these symptoms, what do you think they are likely to be diagnosed with? Depending on which one's more dominant: ADHD, anxiety, depression, oppositional defiant disorder, insomnia. Now, are they going to be treated for what they should have been treated for? Or are they getting treated for a symptom of an injury that was never diagnosed? Which is why the end of this is very important. Unfortunately, in the vast majority, the diagnosis is missed, and physicians, medical, and teaching staff who are involved with these children should be aware of the cause and effect related to MTBI. Okay, now when we look at adults, what were some of the common symptoms they had? Well, headache, concentration, fatigue, fog, depression, anxiety, irritability, insomnia. Once again, we see a lot of mental health stuff that could be diagnosed. But is it because they have mental health issues? Or is it because they have a concussion that was never dealt with? What they find in this study, we found that 20% of our population eventually recovered, and 67% who did so within the first year. Hint, 27% eventually recovered, right? That's 73% that didn't recover in this study that they did. Well, you may say, well, this was just a small study. What do others show? All right, here we go. Outcome in patients with TBI without basically a bleed fracture. Well, they find 27% had functional recovery and 73% not recovered at 2 weeks, but at 6 months, 44% had functional recovery and 56% still were not recovered. And when we look at the other studies, they're basically saying, hey, after 6 months, people are not spontaneously recovering. So if it's 56% then, it's probably actually 56% years down the road, because it's not like you're going to magically wave a wand and be like, it's gone. That's not the way it works. But yet people are magically timing out concussions like, oh, but it's been a month. It's been 6 months. It shouldn't be impacting you. Or maybe you were never even given the diagnosis to begin with. And the last one we're looking at is assessment of follow-up care after visit for a TBI. Among patients with 3 or more moderate to severe post-concussive symptoms, only 52% reported seeing a practitioner within 3 months. So barely half saw a provider, even though they got a diagnosis. And when you look at who they saw, it was anyone. It wasn't even someone qualified. It was just anyone. Why does this possibly occur? Well, part of it's societal stigma, but the other part is 42% of patients reported receiving educational material at discharge. They weren't even educated on their injury. if you're not educated and you don't think something's important, you're probably not going to think it's a big issue. So what do you think, right? Could you have a concussion that then causes mental health diagnoses? Well,
I think it's safe to say, after reviewing that research, it is abundantly clear that concussions ultimately lead to a lot of issues with mental health, not only immediately, but years down the road. Now, one of the reasons I actually, in my office, I market to treat mental health is because I know a lot of people, just like many of you, you have been given that mental health label when in reality it was a concussion, or maybe it was something else, right? That is creating the mental health label. But that's what you're tied to because that's what you've been told. And so when we step back, we identify what is the root cause, right? You can finally get the answers and treatment that you need. I hope you found this video useful. What questions, comments do you have for me? Also, please share this with others. That's the only way this channel grows and we're able to help more people. And ultimately, I'm going to keep making videos because I want, they're helping. And please check out the other videos that I have. Till next time, it's Dr. Z. I'm known as the Brain Guy.